Health experts are warning that a new global health crisis could be on the way.
Officials are sounding the alarm over monkeypox, and we want to warn you some of the images we're showing may be a little bit disturbing.
But they are the best way to show the effects of this virus on people who've already caught it. President Biden says monkeypox is something that should concern everyone. World Health Organization officials reported at least 92 confirmed cases and 28 suspected cases in a dozen countries, including the U.S. Symptoms range from fevers to chills to fluid-filled lesions that appear on the skin.
We are joined now by a familiar face, Dr. David Wohl, an infectious disease specialist with the UNC School of Medicine. Dr. Wohl, thanks for being here with us, taking time. Clearly, you're busy right now. What is monkeypox, and should we be concerned about it?
Monkeypox is a virus. It's a virus that is transmitted mostly from animals to people. We find it endemic, now that everyone knows what that word means, endemic in parts of Africa, West Africa specifically. And while there have been a lot of cases there, it's very rare to see cases outside of that region. There is human-to-human transmission that can occur. It's not nearly as infectious as something like COVID-19. And almost 200 cases now have been detected through Europe and into Canada. And now we even have at least one, maybe two cases here. So I think we'll see some cases here. This is being transmitted from person to person and not from animals here. So I don't think it's something we have to be super concerned about, but we should all know about.
Well, we're looking at the images, which are a bit disturbing and tough to look at. And it looks like it would itch and be painful and not comfortable whatsoever. What is stirring all this up? Why are we talking about it now?
Just the number of cases. We started to see this in the UK and London from originally someone who came from Nigeria, but then we started to see cases pop up that weren't related to that person, that weren't directly linked to that person. And now we've seen cases in other countries, including in Canada, here in the United States. So we just have to be prepared. It looks a lot like chickenpox. I think people will see this and say, hey, that looks like chickenpox. How do we tell the difference? Well, if you've had chickenpox before and now you have these lesions, well, you don't have chickenpox again. You only get it once generally. And so if you're not a child and you start to see these lesions, this would be concerning. Again, we're seeing this link to where people are gathering together. Sometimes we think that there may be sexual transmission. So we're trying to understand a little bit more about how this is being transmitted from person to person. But again, this is not as catchy as something like the flu or COVID-19. So we're not going to see huge numbers of cases.
Well, and that is some good news. And you're helping to work on a task force with the state just to keep an eye on numbers and what should happen. Is there, or are there any treatments or any vaccines out there that kind of give doctors a jump start on tackling this virus?
It's really interesting. For those who are old enough to remember, before 1972, we all got vaccinated for smallpox, which is related to monkeypox. It's much more severe than monkeypox. And there's some data that suggests that we are protected, those of us, to some extent, by being previously vaccinated against smallpox. Now, if you were born after 1972, you don't have that immunity. But there is ways to vaccinate people so that they are protected, especially if they're exposed. And maybe even vaccination could be used for treatment. There's also some antiviral drugs that were developed for other purposes that seem in the laboratory to work against monkeypox. Good news, too, is that the lethality rate for this is around 1%, as far as we know from West Africa. So 99% of people just get better all on their own. But there are severe cases, especially children. And so we just have to keep an eye on this, just make sure. There was an outbreak several years ago in the West. 47 people got it, 19 ended up hospitalized. But, you know, everyone survived.
Yeah, well, before the phone calls start, we are not here to make people panic. That is not our job. We're just wanting to let people know what the news is around the world, what the WHO is saying, and, of course, Dr. Wohl, what you're saying as well. Before we let you go, we haven't talked about COVID in a while. We know in the last couple of weeks we've had stories with Moderna and Pfizer with, some booster shots and vaccines available for even the younger kids. What's the latest when we still talk about COVID?
Right. So what we see is that we're extending vaccination to more and more people. So for boosters, we know that you can now get a second booster if you're over age 50, which is great. I expect that age limit to be lowered as we get more federal funding to make vaccination more available and free. We also know now that the Pfizer vaccine can now also be boosting kids who are as young as 5. So I think the more people we get vaccinated and boosted, boosting is part of being fully vaccinated, the more people have protected from getting really sick. And that's what we need to do, is just prevent people from getting really sick from COVID-19. And these vaccines with the boosting, it's really important to complete the series with boosting. We're learning that makes all the difference, especially with Omicron.
Dr. David Wohl, thank you. Your time is precious. We appreciate all you're doing to not only research, but helping people stay healthy. We're going to let you get back to it this morning. We appreciate everything that you do.
Thanks for spreading the word. Take care.
Thank you.